Good afternoon. My name is Varsha Thottananiyil. The name of my study is Effect of Planned Naps and Fatigue in Nurses Who Works During 12-Hour Night Shift. The problem identified for my study was that the nurses work very long hours, including 12-hour shifts or more, which can cause extreme fatigue in nurses. These fatigue can be resulted from extreme sleep loss, prevalent of long shifts, and it can jeopardize the safety of patients and increase the medication errors and other medical errors which can be prevented. One of the recommended technique to prevent this fatigue is taking scheduled naps or taking power naps during their breaks during the night shift, which can help reduce the sleepiness and fatigue. This study aims to explore the relationship between nighttime fatigue and planned naps. The purpose of the study is to evaluate the effect of break time naps on fatigue during a 12-hour shift. So it was hypothesized that the nurses who nap during the night shift have reduced fatigue levels. Sister Calista Roy's adaptation model was used as a conceptual framework to examine the relationship between planned naps and fatigue. The research question for this study was that does taking planned naps help reduce fatigue in nurses working 12-hour shift? Methods. A quantitative, non-experimental comparative design was utilized in the study to examine the relationship between break time naps and nurses' self-reported fatigue during their night shift. A sample population of night shift nurses who are part of New Jersey State Nurses Organization was selected. A convenient sample of the nurses was selected. The subjects completed an anonymous survey consisting of demographic information and fatigue assessment tool. Fatigue assessment scale is a 10-scale item evaluating symptoms of fatigue. So a total of 86 participants completed the survey, in which 4 of them were males and 82 of the participants were females. To complete the study, an independent t-test was conducted to compare the significance of planned naps during the night shift and overall fatigue in the participants. As part of the evaluation tool, overall fatigue, mental fatigue, and physical fatigue were also evaluated and calculated. The study concluded that there was no statistical significance between planned naps during the night shift and overall fatigue and physical fatigue. Each of them yielded a p-value of 0.70 and 0.07 respectively. But the study concluded that there was a statistical significance between planned naps during the night shift and mental fatigue, which earned a p-value of 0.004. This signified that there is a correlation between planned naps and fatigue. Nurses who took naps had a reduced mental fatigue during their shift. Conclusion and significance to healthcare. Extreme fatigue in nurses during the night shift had been addressed for both patient safety and night safety, and patient and nurses' safety. Many nurse managers and healthcare organizations does not fully understand the importance of fatigue and the resultant patient errors and medical errors, which can be prevented. Night shift nurses also had higher risk for motor vehicle accidents on their way home, resulting because of extreme fatigue that they face. American Academy of Nursing suggests new ways to reduce fatigue. Night shift workers work irregular hours and which can compromise their human physiology and compromise circadian rhythms. As for future recommendations, I suggest that finding new ways other than planned naps, which could help relieve fatigue in nurses. Another recommendation that can be done for future studies is the evaluation of chronotype and how that affects nurses' fatigue. And thank you for your time. Thank you so much.